And what I've learned from all of us is that we see those diseases, preventable diseases, as a majority of what we do in our practices.
Yeah.
And the thing that I think a lot of people forget, Casper, is that doctor is Latin for teacher.
Yeah.
The onus is on us to not only treat our patients, but to actually teach them.
Yeah.
And that's something that if you could prevent disease, stop it before it happens, why would you not do that? Now, there's a lot of obviously pharmaceutical and insurance and hospital administration incentive to keep people sick, which is what we are learning and we are trying to expose. But there is a lot of it where, with the research that's coming out, there's a lot of preventable disease that can be managed through a plant-based diet. I think Garth Davis has done a really good job with that. Um,
Does he
I
have the same? He does the same as you, right?
he's actually a bariatric surgeon, so he's a weight loss surgeon.
Oh, okay. Okay.
Yeah, in North Carolina, and
Yeah.
he's such an outspoken person. I love everything he's got to say. He's very entertaining too.
Yeah.
Um, and it's nice to have other people who are operators too, because it's not as if we're just taking the medicine approach,
Yeah.
which is people and treat people with both prevention and medication, but it's also we get to operate on, so we get to see what the blood vessels look like. I get to see what all of it, what the results are of people's lifestyle. And what you learn is a very judgment-free but very compassionate approach to helping our patients. So I use the science. I say, all right, well, you've got this particular problem. I don't always mention right off the bat the dietary and exercise aspects because
Oh.
time is so limited in what I do. However, if they do ask me, I am more than happy to provide them that information, and I do, and I counsel them on
Mm.
how this disease could have been prevented. I give them the research. And like I said, I talked about that Journal of Vascular Surgery paper that came out with Dr. Esselstyn and Dr. Davis. Both of them are on that paper. Um, I use that to guide me with how I approach patients.